Thanks for having me, everybody. It's nice to meet you all. And for the introduction, I just tell you a little bit about myself. I've been a nurse specialist in uro-gynaecology for a very long time now, nearly 15 years. I've worked at Guy's and St Thomas's for 15 years as a urogynae nurse. Before that, I was a sister on a urology ward, so I've tended to concentrate on this area of our body because actually there's lots of things that can go wrong and very simple things that you can do to make things go right. And that's the reason I ended up doing urogynaecology. I moved from Guy's and Tommy's about 6 months ago up to Suffolk, sleepy Suffolk. It's a little bit of a shock, very, very different to how it was at Guy's and Tommy's, but really enjoying setting up a new service for women who've got problems with their pelvic floor. And that's what I'm going to be talking about today. Hopefully it'll be nice and informative. I'm sure there'll be loads of stuff that you've already heard about, but there might be some stuff that you haven't heard about, or little tips you think, oh, I could do that, or I could try that, or I might buy that, or I'll go and get a referral to see a specialist to help me with my problems. This problem affects men and women, so if there's gentlemen in the crowd, then there may be things that you might think, oh yes, I could try that too. So hopefully it'll benefit all of you. If I can work this. Right, so looking and thinking a little bit about incontinence, it's incredibly common, and it's one of those taboo subjects. Nobody likes to talk about it. And it's probably affected all of us at some point in our lives. I've just detailed here some of the areas that it can affect our lives and our quality of life. And when I treat ladies, I ask them about their quality of life, and I ask them what's the most bothersome thing and what are the things that are affecting their quality of life the most. As I said, these are some of the most common. So it can affect your physical well-being, so it can mean that you don't exercise as much. It can mean that you stop doing things that you've enjoyed doing in case you have a problem with your bladder. It can affect your sex life. People can avoid sexual contact and intimacy because of fear of having incontinence or smelling not very nice or just not feeling sexy. It can affect your occupation, so you're always having to go to come up and see a specialist. Or I've had a number of women say, people take the mickey out of me at work because I'm always in the toilet. Domestic problems, so it increases your washing load. Sometimes people buy specialist underwear and it costs a lot of money to buy pads. Now, I'm all for people putting these tenor lady adverts on the telly, but I do sort of slightly cringe as well because I think that's making it a bit more acceptable. It's good to be talking about it, but pads aren't, in my eyes, something that you should be reverting to. Hopefully, after today, you'll be thinking, OK, I'm going to keep buying my pads for a while, but I'm going to look at ways of treating it so that actually I don't need to end up using my pads. It has a psychological impact on our quality of life. We feel depressed. We feel fed up. Who likes to wet the pants? Nobody does. So you end up with a loss of self-esteem and fear of being a burden on other people around you. And obviously then it can impact on your social life. Number of people who say to me, I really want to wear a white pair of jeans, Ellie, but I can't. I've always got pants in my bag just in case. So it affects activities socially as well. So why do we think it's underreported? If you think you've got your problem with your bladder, why haven't you gone to see someone to talk about it? And I'm sure probably some of these reasons will pop up. You're embarrassed. You've got a young male GP and you don't want to talk to him about the fact that you can't quite make it to the toilet or that you leak if you cough and sneeze. You feel embarrassed about it. You feel shameful. And often what women do, we're real copers as women. We find ways of changing what we do to try and mean that we can cope so that we don't then have to go and bother anybody. So often women have coped and changed their lifestyle, which probably, as you'll see in a minute, doesn't always help bladder problems. And they've put up and put up and put up, and it's only when it's quite serious do you come and find help. And actually, if you were aware of the help that there was or had plucked up the courage to do it earlier, then it's a lot easier to treat often. Lack of awareness of available treatment and the fact that people consider it to be a normal part of getting old. I had a little old lady come in to see me the other day. She said, the first thing she said to me was, I know you can't do anything to help me. This is just what happens when you get old, isn't it, Ellie? And by the end of the session, she'd realised there are lots of things that she can do that hopefully will mean that, not necessarily that she's cured, but that it will have an impact on her quality of life. So there's a few main sorts of problems that you can get with your bladder, and I'm just going to go through some of these throughout my talk. The first one is stress incontinence, coughing, sneezing, and you leak urine, running, jumping, having sex. Anything where your pressure here in your tummy increases, but there's no oomph underneath to support it anymore. So I'm sure we've all been in the situation where you have a proper laugh or you have a sneeze and you think, oh, gosh, and you have to do that. You have to cross your legs. So that's stress incontinence, leaking with coughing, sneezing or increasing intra-abdominal pressure. An overactive bladder, having to rush to the toilet. You know that feeling you think, I better go just in case, and then I know the toilet's there in Marks and Spencer's, and I know the toilet's there in Henny's, and I know the toilet's there in the cafe on the way home. So it's having to always go to the toilet, it's having to rush to the toilet, not quite making it, getting up at night time a lot to go. Some women suffer with voiding difficulties, which means they don't empty their bladder properly. And that can be due to fibroids, prolapse, if you're a gentleman, prostate problems. Functional incontinence, a number of older ladies I see who've got a corset on and 5 pairs of pants and all this sort of stuff. By the time they've got to the toilet and taken everything down, there's no hope. Even I would make it to the toilet without having a problem. So that's functional incontinence. Or someone who's got dementia or problems finding and remembering how to get to the toilet. And as I said, a prolapse can cause problems with your symptoms. So let's talk a bit about stress incontinence. So as I said, it's leaking when you cough, you sneeze, you run or you jump. So anything where there is a leakage as a result of raised intra-abdominal pressure. So what are the causes? One of the main causes is children. The main cause for lots of things in our life, but it can cause problems with our bladder. So the number of children that you've had, the way your babies have been born. So if your babies were pulled out with forceps or ventouse, that can cause problems. If you had a long second stage, you were pushing and pushing and pushing for a long time, or you had a very quick labour, that can cause problems. If you had stitches or tears or third-degree tear, that can cause problems. So childbirth is quite key. It's as the baby comes out through the pelvic floor that's when it does the damage. Another time that women present to me is a time of the menopause. Now, unfortunately, around the time of the menopause, your body produces less oestrogen. And oestrogen has a big impact on vaginal tissues and keeps our urethra tight and our pelvic floor in good nick. So without so much oestrogen, we can end up with some problems, and it can make things weaker, which can cause symptoms of stress incontinence. After a hysterectomy, and this is often what happens with ovarian cancer treatment, you have a hysterectomy and a big clearance of your abdomen. 35.5% of women have problems with incontinence. So it's quite high because of the nerve damage. They can't nerve spare when they take everything out. And often women were absolutely fine before they went in, then they had the hysterectomy and came out. So I see women all the time who have had a hysterectomy who haven't got ovarian cancer and still end up with problems with incontinence. If you've got a chronic cough, so you're coughing, 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 coughing all the time. I don't know if any of you have ever put your hand there when you cough, but you can physically feel things move up and down. So if you're coughing a lot, this just, especially over sort of the winter time when you're quite likely to get the flu and stuff, that makes the pelvic floor weaker. And unfortunately, and I never look at anyone at this point because I don't want anyone to think I'm looking at them, if you carry a bit of extra weight on your tummy, everything you're carrying here, you're carrying on your pelvic floor. And the research has shown that if you lose a few pounds, and I'm not going to lecture anyone on losing weight because I know how difficult it is, but if you lose a few extra pounds, often your bladder symptoms improve significantly. So that's one of the ways that I would always look at for a simple, not simple, but an easier fix. Any questions on that? So, the main treatments for stress incontinence that we will always suggest are pelvic floor exercises. Now you're all probably going, oh God, I've heard about these, I can't do them, or I've tried them and they don't work. Now, the number of women who come to me and say, I've tried those, Ellie, they're rubbish, they don't work. Fair enough. I would always think, right, I'm going to start again today. These do work, and these do work. There are lots and lots of bits of research that have been done that show pelvic floor exercises, when done properly, can significantly improve your bladder symptoms. Ideally, you should be doing them 8 contractions 3 times a day. So what I would say is it's the regularity of doing them. So people will come back and I'll say, have you done your exercises? Yes, I have. How many times do you do them? I did them once last week. Well, I think there's no point in bothering. You need to be doing these exercises at least 3 times a day, if you can. It's the regularity. It's the same as if you're going to run them, if you're going to do anything, exercising a muscle that's not been exercised for a while. If you just do it occasionally, it's not going to improve things. You need to be doing things regularly. Would you like me to talk through pelvic floor exercises with you so you know how to do them? Right. So the pelvic floor, this is where it's not very elegant, and I probably should have worn trousers. So your pelvic floor's here. So it slings round from the hard bone at the front all the way round to the backbone at the back. So it literally is the floor to your pelvis, and it's a number of very different complex muscles that all make up the pelvic floor, which if it's stressed can get weaker. The way that I would suggest that you try and do these exercises, there's two parts. There's the front part and the back part. So one way I suggest to women is they imagine that they're queuing up in Sainsbury's and they really desperately need to pass wind, and they think, oh God, I can't do this now. So you tighten up around your bottom, not your bum cheeks, but your actual around your anus, as if you're trying to hold wind in. All have a try. I bet you're all trying. No funny faces. So squeeze up around your back passage as if you're trying to hold on to wind. And how many of you ever tried to stop the flow of urine when you do a wee before? Now that's how they used to teach it in the old days. I wouldn't recommend that you do that now. Don't sit on the toilet and try and stop the flow, because it can cause problems with how the bladder works. But that's effectively the feeling that you need to feel. So you basically need to be squeezing up. Another analogy, imagine you've got a bit of spaghetti and you're trying to squeeze the spaghetti up. Imagine you've got a pencil and you're trying to hold the pencil in. So I want you to all have, I know there's lots of different analogies, it's just trying to get what works for you in your head. So there's two different sorts of exercises, one the fast twitch and two the slow twitch. The fast twitch is where you squeeze everything up and you relax, and up and relax. So I want you to have a try of this now. The important thing when you're doing your exercise is you breathe and you don't pull a silly face. No, most of you will be pulling silly faces because it's actually quite hard to concentrate on squeezing down there without pulling a concentration face. So you need to squeeze up as if you're trying to stop the flow of urine and as if you're trying to squeeze around your back passage, and then let go. So let's all try and do a few of those now. Not moving your tummy, not moving your bum. So if I see any of this, you're doing it wrong, or you're doing it wrong. Because it's not these muscles, it's this muscle inside. So I'm doing my exercises now and you can't see any movement at all. It's an internal movement up, okay? And that's really important. And you need to breathe, and that's really important. If you do that, you then can't concentrate on doing it properly and it doesn't relax properly, so you need to make sure you breathe. So let's do 5 of the fast ones. So squeeze up and relax. Breathing, squeeze up, no squeezing of the wrong muscles, and relax. And up, and relax, and one more, and up, and relax. Good, so they're the fast twitch. The slow twitch is where you squeeze up and you hold. 1, 2, 3, 4, 5, and you relax. And have one more go, squeeze up, 1, 2, 3, 4, 5, and relax. Now they're the slow twitch. How many do you do? Do until your muscle feels tired. If you can only hold for 3 seconds, hold for 3 seconds. If you can hold for 10 seconds, hold for 10 seconds. So you're challenging your muscle. If you can't hold for 10, it doesn't mean you can't do them. I'd much rather people held for 3 seconds and did them well and then could improve than does rubbish ones and then gives up. So set a routine, and this is where you need to be referred to a women's health physiotherapist or a specialist if you're not sure you're doing them properly. One way of testing if you are, depends how squeamish you are. One, you could put a finger in your vagina, and when you squeeze, you should feel your muscle tightening around your finger. The other one is, you know the bit of skin called the perineum between your vagina and your anus? If you put your finger there and squeeze, you should be able to feel a movement up. If you feel a movement down, like that, you're pushing down and making things weaker. So if you're not sure you're doing them properly, that's the time that you need to be able to get a referral up to a physio. How do I do them? Sitting, lying, standing. They're easier when you're lying down, because when you're lying down like that, there's no gravity. As soon as you sit up, everything's resting on the chair, but it's still on your pelvic floor. As soon as you stand up, you're like weightlifting, so it's much more difficult. So start off whilst you're sitting and lying, and then move up to standing as your muscle gets stronger. Okay? The other thing, how many of you leak when you're standing still? Not very many. So you need to start using your muscle before you cough, before you sneeze. Instead of doing that, do that. So you're squeezing up underneath. So before you are likely to leak, that's when you need to be doing your exercises. So do they work? Yes, they do. There's strong evidence to support pelvic floor muscle training as to improve your bladder stress incontinence. Expected cure rates are up to 73%, and some women are actually cured or improved up to 97%. I always ask people, how are you getting along, before I examine them. And often symptoms improve, but pelvic floor doesn't necessarily improve a lot. And I always think if it's improved your quality of life and it's less bothersome, that's the right way we're looking at it. So it doesn't necessarily mean I have to feel a massive improvement. It means I have to see a massive improvement in how you feel your symptoms are. And that for me is quite different. Handing out a pelvic floor exercise leaflet, you can get information all over the internet about this. I think if you're not sure you're doing them properly, that's the time to go and seek help. Even if it's just a one-off with a physio or someone who knows what they're doing, just to show you and tell you you're doing them correctly is really important. Now, we all have a look in the Daily Mail, hopefully not, and you see all of these things that are advertised to help improve your bladder or your pelvic floor strength. There's a lot of stuff out there. A lot of stuff is really useful and a lot of stuff is very expensive and probably not always necessary. So again, if you're not sure, I would look at speaking to a specialist once they've examined you and once you've tried to do your exercises regularly. Because we're now talking about our vaginas more and we're talking about our problems with our bladder, there are a lot more things that have come onto the market recently. As I said, they can be expensive, so it's definitely worth speaking to someone who knows what they're talking about before you spend a lot of money. So some women are very keen on doing exercises and exercise, and their pelvic floor isn't strong enough to support things. So even though they're working at the exercises, it's not quite enough to stop them leaking. So there are now things that you can put into your vagina which sit inside and support the bladder neck to stop you leaking. So we've got a ring with a knob bit on the end. So that sits inside the vagina, and the knobby bit presses on the urethra or at the base of the bladder to support the bladder neck to stop you leaking. We've got this device here which is called the Arrestor. And that's, again, sits inside the vagina and supports the bladder neck. So I see a lot of young women who've just had children and who are wanting to get back to exercise, but they can't because they leak so much. And this is a way of using something inside the vagina which may help. These are a couple of good devices. I think you should all download the app, which is called Squeezy. It's designed by women's health physiotherapists at Lewisham Hospital. It's won 1 million awards. It's fantastic. I think it costs £2.50. You download it, and it buzzes you to remind you to do your exercises regularly. And there's also a lot of really useful information on there about how to do your pelvic floor exercises. That's fantastic. There's also this for women who have got a bit of money to spend. This is about a bit over £100. It's a little device. It's called Elvie. This little device here sits inside the vagina and you squeeze it. And it provides feedback. You download an app onto your phone and it provides feedback onto your phone. And then what it does is it's got little games. So there's a little red dot and you have to squeeze your muscle to hit the dot and then relax it again. And squeeze it again and relax it again. Or there's bees that you have to follow. So it's a good way of making your pelvic floor exercises, which are actually very dry, into a little bit more fun. A lot of the women that I know have bought this think it's absolutely fantastic, and it's a really good way of motivating yourself, because it can be quite boring doing these exercises and you're not sure if it's going to improve things, but adding this can improve things. And we know this is you can get this on the internet, and it's also available in John Lewis and stuff like that, so it's widely available, but it is a little bit more expensive. If you're spending a lot of money on pads, it might in the long run be worth thinking about something, but it's out there. Of one of the things that's used at the moment. So now we're looking at overactive bladder. So overactive bladder, rushing to the toilet, not always being able to make it, getting up to the toilet a lot at night time. So this is a normal bladder. Normal bladder fills up, you get the urge to go, you think, oh, I can't, I'm talking to Ellie, I'm listening to Ellie. I probably should go to the loo, but I'm not going to. I'm going to listen to her talk a bit more. The bladder fills up a little bit more, You can put it off until you think, right, it is socially acceptable, I can go to the toilet. So the bladder's nice and relaxed as it's filling. Someone with an overactive bladder, their bladder's a bit like this. So it starts to fill up, you get the urge, you think, oh God, if I don't go to the toilet, I'm going to be in real trouble. So you go to the toilet. So it goes like this. So it doesn't ever fill up a lot. So the capacity can quite easily reduce. And if the bladder capacity is reduced, when you're sitting on the M11, like I was the other day, in a traffic jam, you're thinking, oh my, how am I going to get to the toilet? So the bladder's just irritated the whole time, which means you need to go to the toilet a lot, and you get that horrible, desperate urge to go to the toilet. And sometimes you can get what we call urge incontinence, which is that horrible, oh my, I didn't quite make it before I took my knickers down. So this overactive bladder can be wet or dry, so you can get these symptoms without leaking or you can get these symptoms with leaking. These symptoms are a little bit more difficult to treat if someone who's had radiotherapy to this area, because the radiotherapy or the brachytherapy can damage the bladder. So this is quite tricky to treat to start with, but it's made a little bit worse if you've had some sort of radio or brachytherapy in the past. So first line treatment of an overactive bladder, before we start any medications, and I'm going to run through all of these one by one. Excuse me. I think if people understand what their problem is, they're more likely then to know what to do and to know how to improve their symptoms. And I've often seen women who've come out from seeing their consultant and they come out and they think, oh, I've got a prescription for a tablet, I haven't got a clue what it is, I don't know anything about the side effects, I don't actually know why they've been prescribed it. So a big part of a nurse specialist role, I feel, is to try and explain it at your level so that you understand what's going on. You understand what the symptoms are, you understand what the causes are, and then you think, okay, yeah, that makes sense. And that's why I've been getting that, and that's what I need to do. So I think a simple explanation of an overactive bladder is really important. Bladder retraining, pelvic floor exercises, looking at what you drink, suppression techniques, constipation and weight management, vaginal oestrogens, and at very last, in my opinion, tablets can help with your symptoms. And I'm going to explain these to you. So you might see a nurse, or what you might want to do, just to see exactly what's going on with your bladder, is write a bladder diary. You don't have to have a printed one, but if you type bladder diary into Google, there'll be a million different ones come up. And what it does is it records what you drink and what you wee. A normal bladder should hold on. You should get a normal sensation to go to the toilet about 250 mils for the first time you feel like you need a wee. And a normal bladder capacity is around 400, 500 mils. If you're drinking normally, which should be 1.5 to 2 litres of fluid a day, then you should be weeing every 3 to 4 hours. That's normal. And I think you need to know normal, because then you can work out whether things aren't so good for you. Ideally, you should do this diary for 3 days. Because it monitors how you are each day, because you're not necessarily the same each day. As I said, it measures the input and the output. Often people don't complete them because they're boring and they're time consuming, and because when you get up in the night you have to remember to put your jug, and if you're at work and all that sort of stuff. But if you can do one, then it does provide a lot of information for you, and an incredible amount of information for us as health professionals to advise you about your fluid intake. And I'll go through that in a minute because that's really important. So what I would do is I would write down for at least 24 hours what you eat, what you're drinking and what you're weeing, so that we can see exactly what your baseline is, and then you know where that you can work from to try and improve some of these symptoms. Fluids. So what you drink has a significant impact on your bladder. The things that irritate your bladder: caffeine. Caffeine in tea, coffee, hot chocolate, green tea. Caffeine irritates the bladder and makes you want to go to the toilet. So I'm sure some of you have had an espresso in the morning and it gets you going, but it also gets you going. So it irritates the bladder. So perhaps if you are rushing to the toilet a little bit too much, and you're not quite making it to the toilet, look at reducing the amount of caffeine you're drinking. So often I'll say, so how much tea are you having? Oh, I'm having 7 cups of tea a day, love. And you think, well, that's quite a lot. It's good fluid intake, but it's not always the right stuff. So you could try decaf. Decaf still has some caffeine in, or caffeine-free. So something like Red Bush, I don't like at all, but I would drink if I had a problem with my bladder. So that's a naturally caffeine-free drink, and that's an equivalent. Apparently it's quite nice with milk in, but I don't particularly like it. So it's either decaf tea or coffee, which do still have an element of caffeine in, or caffeine-free. Citrus drinks, so orange juices, grapefruit juices, all that sort of stuff irritates the bladder or will make you want to rush to the toilet. Alcohol will make you want to go to the toilet. We all know after a few beers, once we've broken the seal, we then have to go to the toilet quite a lot throughout the day. So just be aware. What I don't say, and some people say stop all of these, I don't, because I'm a bit of a realist and I know that stopping all of these is, you need to live your life a little bit as well. But what you can do is you can reduce, or you know, if you stop alcohol for a week and it makes a significant difference, then you know that's what your problem is, or vice versa with the caffeine and stuff. So a lot of people also say, I'm getting up a lot during the night, Ellie. What can I do about it? And they take a big pint of water to bed with them, and they have 3 or 4 cups of tea in the evening. Think about what you're drinking and when you're drinking it. if you need to take something to bed because you wake up thirsty, take a little bit and sip it. Don't take a whole pint and gulp it, because whatever you drink, you will need to get up and go to the toilet. And often if you restrict what you're drinking, say from 9 o'clock in the evening, it can then reduce the number of times that you get up during the night. It's just simple things like that sometimes.
Ellie, can I ask a question?
Yeah.
What's the time difference between consumption in your mouth and coming out of the womb, into the womb?
It depends. So a lot of women say to me, as soon as I drink, I need a wee.
Yeah.
And that's incredibly common, and that's usually because you're dehydrated. So if you take a pot plant, one that you water every day and one that you water once a week, what happens to the water in the one you water once a week? Does it go straight through or does it sit in? Straight through. What happens to the water in the one that you water every day? It doesn't come through. And that's how it happens with our bodies. So if someone's saying, I can't increase what I'm drinking because I go to the toilet straight away, I would start off drinking a little bit more throughout the day. Get yourself, I was going to say a bottle, but probably not one like that, but a bottle of water that you can just sip on so that you can keep yourself topped up. You may find initially when you increase what you drink that you go a little bit more anyway, just because you are drinking more and your body's getting used to you drinking more. But as you get used to that and it sort of tips over into the hydrated feeling, you then won't need to go to the toilet as often. So women often, if you can try that, then you often notice a significant difference. So often people with an overactive bladder, if as soon as you start drinking, it just comes through, because what women do is they don't drink because they think, if I don't drink, I'm not going to need to wee. But actually that irritates the bladder because the urine is stronger, it's concentrated, and actually then does make you want to go more. So if there's one thing you can do is to make sure you're drinking enough fluid, which is 1.5 to 2 litres a day. It depends what it is, because so caffeine can come through quicker. Yeah, so things that...
within 5 or 10 minutes, or half an hour, Or...
Yes, it'll probably be more likely to be half an hour and an hour than 10 minutes, because it has to work its way through everything. But if you aren't drinking enough, then it does come through much quicker, because you're not hydrated.
Sorry, if you're well hydrated, should you then not be going until your bladder's got about 400 millilitres in?
If you're hydrated and you don't have a problem with your bladder and you've got a reasonable pelvic floor, you can often hold on to 400 and 500 mils. But if you're drinking normally and you've still got an overactive bladder, then you probably won't be able to hold on to that much. Does that make sense? Yeah. So we're looking at bladder training. So as I said, what people do is they think, right, I'm going out, I know what I'll do, I'll go to the loo just in case. And then they come downstairs and they think, I better go one more time just in case. And then they get out of the door and they walk past the toilet in the station and they think, I need a wee, I'll just go just in case because I'm not sure. And then they get to work and they go just in case. All these just in case trips to the toilet can actually cause more problems, because the bladder's a very sensitive organ. And as soon as it doesn't like working. And as soon as you start to make its job easier for it, it will start to influence you. So as soon as you start going a lot, it'll think, okay, I'm going to make her think she needs to go to the toilet more often, and then you go more often, and then that becomes normal. So then every hour becomes normal, and every hour isn't normal. Every 3 to 4 hours is normal. So very quickly, someone with an overactive bladder, for all these coping reasons that we do, end up with big problems because they're going when they shouldn't go. So try and restrict when you're going. So try and hold on. So think, gosh, I need to go to the toilet. Right, what am I going to do? I'll distract myself. I'll walk around the office before I go to the toilet. Or I'll sit at my desk and I'll play with my phone. Or I'll squeeze my pelvic floor a little bit. Distract yourself and then go 5 seconds later. 5 seconds, 10 seconds, 2 minutes, 5 minutes, 10 minutes. You're trying to slowly increase the time between going to the toilet. Obviously start at home when you're in control of the situation. Don't start doing this the first day when you're going to go on a big long journey, because that's not going to work and you're going to end up in trouble and you're going to get more stressed. And the more stressed you get, the more problems you have with your bladder, because stress can influence the number of times you go to the toilet. Sorry. Suppression techniques. So I don't know if any of you have seen, have been to the market, say you've got your shopping bags and you've been absolutely fine, you walk home, you see the front door and you think, whoa, I'm going to have a big problem. Okay, and how many of you have done this when you go to this, you put your key in the door and you're doing that on the doorstep? Do you know why that is? You've got pressure sensors in your big toes, which when you put pressure onto them, helps relax the muscle. So when you see a little girl and you say, do you need a wee? And she's like, no. Do you need a wee? Are you sure you don't need a wee? No, and she's doing that. That's because it's that whole running on the toes can help to relax the bladder. So if you do that and you're opening the door, that's good. If you're doing that as I'm sure we have, or if you try and squeeze your pelvic floor once your pelvic floor gets stronger. They're ways of trying to suppress underneath. So it's known if you contract your pelvic floor that it relaxes your bladder so that then you don't have to rush as much. So that's another reason why it's really important to do your pelvic floor exercises.
So do I just ask, so the one problem I do have is I can be travelling back from somewhere, absolutely fine. As soon as I get to my front door,
Yeah.
suddenly
Yeah, yeah.
it's psychological.
Yes, so a lot of it can be psychological, yes. And that's happened to me before.
Yeah.
You're absolutely fine, and then you think, but it doesn't...
As soon as I'm in the front door, though, that's it. I can't wait.
Yeah, and so a lot of that is your brain, a lot of that is your bladder influencing your brain, yes, and movement. So stand by the front door, do some deep breathing, some holding on, and trying to get rid of that habit that your bladder and your brain have got into. Okay, but that's incredibly common. So bladder training, so overactive bladder is fluids, it's pelvic floor exercises. A stronger muscle underneath can support the pelvic floor, which will hopefully stop you needing to rush to the toilet as much. It's bladder retraining, and then we can look at medications. Medications are fine and they can significantly improve your bladder symptoms, but a lot of them come with side effects. Side effects of dry mouth and side effects of constipation. Now, if you're constipated, often your bowel, if it's full of stool, can push onto your bladder, which can reduce your bladder capacity. You can then need to strain to open your bowels, which then weakens your pelvic floor. So actually not particularly good if that is a side effect that you experience. So what I would always suggest is that you try these simple things first to see if that will help improve things, and then we can possibly consider starting you on medications to try and improve your symptoms if not. Pelvic organ prolapse. So a prolapse is where the vagina, the walls of the vagina aren't as supportive as they used to be. And you feel like you're sitting on a lump, or you can feel something in the vagina that's not comfortable. Ever so common, especially after having children. If you imagine how much your vagina has to stretch to allow the baby out and the pushing, the vaginal walls never quite are the same after you've had children. You can strengthen your pelvic floor, but that doesn't impact on your vaginal walls. So you end up sometimes with what we call a prolapse. So symptoms that people tell me about, feel a bulge in the vagina, feels like they're sitting on an egg, or there's something in the vagina the whole time. Some women say they get backache, and that's because the ligaments are pulled as the vagina drops down a little bit. And sometimes your whole womb can come out of your vagina. So I remember I saw a little old lady the other day, and she said, "Oh, I've got a really bad, I've got this lump down below, Ellie. Will you just have a look?" I had a look, and she had what we call a procedentia, which is the whole of the womb had gone inside itself and was hanging outside the vagina. So again, that's where people don't necessarily ask for help because they're not sure or they're scared or whatever. But there are things that we can do, which I'll talk about in a minute, to try and improve symptoms of a prolapse. They can be more common following a hysterectomy. So again, this is where it links in with you. If you've got your vagina and you've got your womb is a good internal support mechanism. When we take away your womb, you've basically got a dead end. So there's nothing at the top. So you've got what we call a vaginal vault. Now, because there's no internal support mechanism, this can drop. So you can end up with a prolapse of the vault, which is the top of the vagina. You can end up with the front wall of the vagina can become a little bit saggier, and so can the back wall of the vagina. So losing your womb can have a significant impact on whether you get a prolapse or not. And a lot of women, again, come to me and they say, "I was fine, I had my hysterectomy, and now I've got symptoms of a prolapse." And that's usually due to the fact there's less internal support, but also that there's been some damage sometimes after surgery. Another symptom is that people feel they don't empty their bladder properly. So they'll go to the toilet, they'll sit on the toilet and think they'll do their wee and they'll not feel that they're emptying their bladder properly. If that's happening to you, what you can do to make sure you are emptying your bladder is to do what we call double voiding. So it's sitting on the toilet, doing your wee, totally relaxed. Now, how many of you sit on the toilet, or how many of you don't sit on the toilet? How many of you do this? I bet we've all done it at some point in a public toilet. If you hover, everything's tight and you can't empty your bladder. You do ideally need to rest yourself down and let the toilet seat take your weight. There's more germs on the handle coming out of the toilet than there is on the toilet seat. So if you're worried about sitting on a public toilet, take yourself some wipes and wipe round or all that sort of stuff, but actually there's more on the handle, which we tend to think less about. So making sure you're sitting, no, you're not doing a hovering. It's very good for your legs, but it's not so good for your pelvic floor and your bladder. So sit on the toilet, do your wee. What I always think is your front vaginal wall can come down so the bladder can drop in. So when you're sitting down on a chair, everything's supported. When there's a hole for the toilet, everything drops down. So what can happen is the bladder can come down a bit and there is a little bit left inside. And that's where you feel you're not emptying. So you might think, oh, I've finished, get up to the go. You think, oh God, I need to go again. So you have to go back and go again. So one of the ways you can stop that is by sitting on the toilet, is squeezing your muscle up and relaxing it, is rocking to and fro, is standing up, sort of wiggling around a bit, sitting down and having another go. And that's what we call double voiding. And a lot of women who've got a slight vaginal prolapse or a big vaginal prolapse can notice a significant improvement by doing that. So there's a number of different sorts of prolapse. One is called a cystocele, or an anterior wall vaginal prolapse, which is the front wall of the vagina. Do you understand what a prolapse is? Would you like me to draw a picture? Do you understand what it is? Or do you want me to just make it a bit easier with a picture? Right. I'm not a very good artist. I will have a try. So, see if you can recognise what this is. Bladder, yeah, bladder. Vagina. With your womb. And your back passage, okay? That's your pelvic floor underneath. So what can happen after you've had children is the vaginal walls can get a bit weaker. So what happens then is the bladder, when it's full, can push and can drop down. So it's not your actual bladder prolapsing, it's just the front vaginal wall's not supporting things as much, so it drops down. The same can happen to the back wall. So when your bowel is full and there's a weakness of the vaginal wall, which basically keeps everything all together, it can prolapse down so you can feel a lump. So some women feel if they've got a back wall vaginal prolapse, they don't empty their bowels properly. And that's because if you've got a nice tight vaginal wall at the back, when you strain, everything comes straight out. But if you've got a saggy or a less supported back wall vaginal, then it goes around like that and it gets caught in the pocket. And so some women say, when I do a poo, I can do some of it, but it never quite feels as though it's empty. And that's just when it catches in the back wall of the vagina. So you've got an anterior vaginal prolapse here, you've got a posterior wall or a rectocele, and then your womb can drop down. Or if you haven't got a womb, your vault can prolapse down. Does that make a bit more sense about where they all are? Because sometimes the doctors explain that and they don't do pictures and I don't think you necessarily always know. So there's only a few management options for a prolapse. One, leave it. And I always think, does it bother you? If it doesn't bother you, I'd leave well alone. Don't consider any surgery unless you need surgery. There's a 30% risk after having prolapse surgery that your prolapse will return. So always think about that. Just because we operate and repair everything doesn't mean you're going to never have a problem again. Pelvic floor exercises, I would say everyone should be doing anyway. It's good for your sex life, it's good to stop you weeing all the time, it's good to stop you leaking when you cough and sneeze, and it's also good to support things to stop you feeling your prolapse. If a doctor refers you for pelvic floor exercises to cure your prolapse, it's a load of rubbish. Because as you can see, your pelvic floor is here, it's not here, which is where the prolapse is occurring. But a stronger muscle underneath can support things better, which then will mean that you don't feel the symptoms of the prolapse as much. We can then look at using a vaginal pessary, which is a thing that goes in the vagina. I'm going to show you some in a minute, which might shock you. And then we're looking at surgery as a last option.
Can I just ask, instead of prolapse surgery, do they sometimes do a hysterectomy where they just take the womb back?
Yeah, so if the womb is prolapsing, they can take the womb out, or sometimes they can hitch the womb up inside. Once the womb's gone, or sometimes if you have your womb taken out because you've got a prolapse, they also then repair the front and vaginal back walls because often prolapses come together. There's not usually just one, there's often a couple of them. So yes, they can take it out and that'll stop the womb dropping down. But as I said, sometimes the symptoms come back in the future because of the lack of support and all that sort of stuff. So we can use vaginal things to go into the vagina to support your vagina, to support the prolapse if you're not keen on surgery. These are all looking a bit weird. These are all vaginal pessaries. Now, I'm sure some of you are aware of, in the news, there's been a lot of bad publicity recently about the use of vaginal mesh, and they've banned the use of vaginal mesh. What vaginal mesh Well, these have now come into their own a little bit more because women aren't having that mesh surgery and are a little bit scared to have prolapse surgery. Although often the first time we repair, we don't use mesh at all anyway. So I know in our trust at the West Suffolk, we don't use mesh at all. We use their own skin to repair them with. But some, before the ban, we're using big bits of mesh, but we're not allowed to anymore. So as another way, then we can use these pessaries which go into the vagina and sit inside the vagina and can support things so that you don't feel the lump there. And they may be an equivalent to having surgery. So obviously there's sort of funny shaped ones. That's called a poppy pessary, which is a support mechanism, and that's called a girl horn. These ones you can't use if you're sexually active because of the obvious reason. That knobby bit, or the stem, sits inside the vagina, which means sex isn't possible. These are the most common ones. They're called ring pessaries. Now, at Christmas, when I was putting my Christmas decorations up, my children, I heard a massive big laughter. Now, you can imagine my kids are quite up with what's going on with my job. They know all the different things, and like, oh, Mum, put it away, you're embarrassing, that sort of stuff. I heard a big screech and Naomi came out with this tinsel-covered vaginal pessary. And we put it and we hung it on the Christmas tree. So it can be used for lots of things, bangles, lots of things. Anyway, but they can also be used to support the vagina, which is what they're meant to be used for, and they can do so very, very effectively as well. So when you come up to see a specialist, it may be that that's something that you consider. I think one of the most important things is that we try and prevent a prolapse. Yeah?
What led to the mesh being banned then?
Pardon?
What led to the mesh being banned?
So there were women who were getting a lot of pain, a lot of lots of problems with the fact that the mesh was eroding through, that it was causing pain, all that sort of stuff. And there was a big group of women who lobbied the government, and the government put a ban on it until we've done more research into what we can use. So in our trust, we don't use mesh at all in Uro-gynaecology surgery. So taking the mesh away, so they were using mesh to support the bladder neck for what we call a tension-free vaginal tape. We were using it for that to cure incontinence, but now we're not allowed to use it at all. So we've had to look at what we are using. And so luckily it's then meant that I've got more referrals because women are choosing not to have surgery, they're choosing to use other devices and things instead.
Is that across all the NHS, is it?
Yeah. Yeah. So prevention is important. Prevention is better than cure. So what we do is we try and avoid straining to open our bowels. How many of you sit on the toilet correctly? Silly question, and I don't want you to answer the question, I want you to answer it in your head. How many of you sit on the toilet like this to do a poo? How many of you sit on the toilet like this to do a poo? This is the correct way to sit on the toilet. Imagine you're a gentleman on the toilet with your Sunday paper, reading your Sunday paper. Your knees are above your hips and you're leaning forward. The reason that's important, and if you try and do a poo sitting normally and a poo sitting leaning forward, you'll find it much easier to open your bowels. There'll be much less straining. The reason that is if you imagine that's your rectum, where your stool is, there's a ligament that goes round it. When you're sitting up straight, that ligament pulls it back. So it sort of has to go in a funny angle. When you lean forward with your knees above your hips and your elbows on your knees, it releases that ligament, which then allows the stool to come out much more effectively. There's something on the market called a squatty potty, which there's something for everything, which is like a stool that goes around your chair. I always say an A to Z or something with your feet, or put your feet up on your tiptoes and lean forward and do it that way. But that's a really good piece of information. And lots of women come back and say, actually, Ellie, I've changed the way I sit on the loo and it's made a significant improvement to my symptoms. Avoid excess, yeah?
Is it okay? My daughter,
Yeah.
she's only 17, but she's done number twos like that for quite a long time. She actually, I'm like, what are you doing? She's got her feet up on the bin.
Yeah.
I've read
Yeah.
that it's easier to poo like this.
It is.
That's not going to harm her being so young.
No.
She just continues
No.
doing
If you
it.
think about Indian people in third world who don't have toilets, they're down like that. They squat in to do a poo, and that's exactly the same as it is when you bring your knees up high. It's actually a much more normal way. Sitting on the throne, we've made it all posh and very British. But actually, if we use it with our knees up, so that's absolutely fine, shouldn't cause, and actually it'll cause less problems because there won't be as much straining, and it's the straining that makes things weaker. So avoid excess weight. So any extra weight here, pushes down. Avoid any heavy lifting. Every time you do that, if you feel that, then you know that you're pushing down, and that can make things weaker. So any raising it into abdominal pressure, and then your pelvic floor exercises. So this is just to show you about the thing about when you're leaking. I mean, when you can't go for a poo properly, that's the best angle, not a 90 degrees angle. So your daughter is doing it absolutely fine.
I hate to tell her she's right.
So the menopause, as I mentioned earlier, is another time when people come and present with symptoms of bladder problems. After radiotherapy to the pelvis, women can suffer with menopausal symptoms. They may get dry skin, vaginal dryness, irregular or no periods, loss of libido, hot flushes and mood changes. None of those are nice, unfortunately, and after having cancer treatment, chemotherapy, a lot of those symptoms can manifest as well. So what we can get is what we call atrophic vagina. An atrophic vagina is where your vaginal tissues atrophy, so they're not in as good condition. So it's the lack of estrogen, which means that things can get drier. You can feel like a discomfort in your vagina the whole time. Sex is a bit more uncomfortable because you don't produce the same lubrication as you do when you're premenopausal or when you haven't got the atrophy. Some women present with itching, which they think is thrush, but actually isn't. It's because the tissues haven't had enough estrogen. Recurrent urine infections, because if everything's dry down there and irritated, the bugs are much more likely to go up. Bleeding, and it may feel that your labia feels sticky. So this at the top here is what an atrophic vagina looks like. So these little red areas, the little red bits of spots of blood, is where the blood comes to the top of the skin. So if you have sex and you notice bleeding, then it may be because your tissue, you haven't got enough estrogen inside your tissues, which is what's causing the soreness and the bleeding. Now, one of the things that I prescribe a lot of are vaginal estrogens, and as soon as I need them, I will be starting them because I think they're a fantastic way of keeping your vagina young and healthy and functioning. The advantages of vaginal estrogens, and this, hopefully I'll be able to allay any fears that you have about vaginal estrogens. They avoid what we call intrahepatic circulation, so that basically they're absorbed in the vagina, they don't go in your mouth, and they're not taken in and don't go through your liver. You can give them at the lowest possible dose. There's no stimulation to the endometrium. There's no need for progestrogens, which are, you just don't need them. There's no systemic side effects, and they are acceptable following breast cancer. The disadvantage is that there's no systemic effect. So if you take an oral HRT tablet, it helps with your bone strength, it helps with your vasomotor, your hot flushes, all that sort of stuff, and it does, and hopefully helps to balance things out. Now, because they're just put into the vagina, they don't have those benefits. But they can make significant improvement to your bladder symptoms and your sex life. People say to me, it's HRT, Ellie. I don't want to start HRT. I'm worried about the side effects of HRT. You know, we've have all the press about, negative press about HRT. To put it into proportion, if you were to use 2 tablets a week in your vagina for a year, it would equate to 1 oral HRT. So you can see it's a teeny weeny dose that goes into the vagina, but it can make significant improvement to your sex life, to your symptoms, to your burning, to your frequency of urine, to your urinary tract infections, to lots of things. So it's definitely worth considering. And I'm going to talk a little bit more about alternatives to the HRT, because there are a lot of alternatives if you don't want to use HRT. Obviously, links in with all this are sexual issues. We don't feel as sexy as we get older if our vagina's sore, if we're worried we're going to leak when we have sex, if we've had chemotherapy, if we haven't got our hair, if we're feeling grotty and not very feminine. It then links into lots of different things which can then become a big problem, and then into vicious circles. So if you can find someone that you can talk to, I always ask people about their sex life. And I think maybe I'm the first person to ask them because they're like, why did you ask me that? And actually, it has significant impact. And I don't think we as health professionals deal particularly well with women who are having problems, and we don't ask. Sometimes I think because we don't really know how to deal with things. But I always make sure that I ask about people's sex life because I think it links in with the quality of life, and it can cause problems if we're not having sex and we want to have sex. And there are a lot of things we can do to make things easier for you. So as another way, vaginal lubricants and moisturisers. Now these have become all the buzz at the moment because this is instead of HRT. So for women who have had breast cancer that's estrogen dependent and they're not allowed or they're scared about using an HRT, even though it's a very tiny dose and you can use it, there are a number of companies that have now made what we call vaginal moisturisers. So they go into the vagina and they keep the vagina moist so that you're then not getting the dryness, the soreness, your sex life's better, you don't feel itchy, all that sort of thing. The ones that I personally, I'm probably not allowed to say this, but I think this company, yes, they make a number of different moisturisers. Some, they make moisturisers and, what's that other word? Lubricants, thank you. Moisturisers and lubricants. So lubricants are used for sex. They just lubricate the vagina for sex, but moisturisers suck in and they encourage the vagina to become more moistureful, if that's even a word, to stop things being as uncomfortable. So you've got, yes, vaginal moisturiser, and then you've got your lubricants as well. So it might be worth looking at some of these. And these are the makes of them here, to see if you're not sure about using the estrogens or you want to try something to make things more comfortable. One of my colleagues came up to me the other day and said, Ellie, I feel like I've got thrush the whole time. It's horrible, I'm itching, I'm really uncomfortable. And I said, I reckon it's the pH of your vagina, because the pH of your vagina changes as you get older, just before your period, after chemotherapy, all that sort of stuff. I gave her some of that. She came back the other day, she said, it's the best thing I've ever had. It's made significant improvement. I don't feel itchy and I know that it's not thrush. I think that people self-diagnose themselves with thrush all too often, and they haven't because they weren't aware necessarily of other things that can be used. So I would definitely think about this to help with your sex life. If it's uncomfortable to have sex, you don't want to try estrogen, then I would definitely look at using a decent, not KY jelly. KY jelly was made to help examine people. It basically dries you out. So as you go in and out, it actually dries the vagina rather than keeping it lubricated. So don't use KY jelly if you're suffering with problems with lubing up. Use some actual proper vaginal lubrication, and that will make sex much more comfortable.